Yo, that's a really bad. You won't believe the results of this. Stick to the end because you're going to be really shocked with the outcome of this procedure. First of all, my name is Dr. Mo and I'm a dentist. If you enjoy dental content, subscribe and like. In this video, we're going to see the upper two front teeth getting prepared and with a restorative procedure being done for both that's really aesthetic and it's going to be really life changing for this person who had it. So this is a summary. Okay, so they're starting by drilling or all the caries. It appeared to be maybe they had a TF, meaning a temporary filling. The extremely wide thing in the middle looks like a temporary filling. And if you can see, the dentist here did some initial preparation before placing the rubber dam. If you're wondering about these white things, these are called dental flosses. I don't know why is there a cat here, but um, so the dentist here is doing some preparation, especially crown preparation on the teeth for both upper front teeth. Very important note here. If you noticed at some point, I think they drilled into the orifice. Yeah, so I guess it was intended to remove that TF. However, when you reach near the orifice, maybe this is a more experienced operator, but for most operators, it's not a good idea to have a high-speed drill, especially that is this huge, to be drilling near the orifice. And I think it's done again, if because any wrong motion here can lead to something called as perforation. There are solutions for perforations like MTA. I'll address this in future videos. But basically, if a perforation is done and the operator doesn't know how to handle a perforation, then this person may lose a tooth. And especially if it's a front tooth, also they're adding the caries dye, the good old caries dye. Um, yeah, so it's just an unfocused part, then it gets better. Okay. So we had the caries dye, which address, again, as I said, the regions that really need to be cleaned. Again, further removal of caries, any remnant temporary filling and decay really is being removed because we don't want recurrent caries or caries happening again. Okay, so I guess that they are this looks like a scalar and they're removing something that were stuck maybe in the way of the rubber dam. They're applying acid etch, which is the bluish thing that you need. You see, this is a very interesting case because actually the anterior teeth, they are one of the most difficult teeth to aesthetically treat, although they're fairly simple from technical point, meaning to do root canal for, to do restorations for, because they're in the front, they're visible, they're accessible, but it's just getting that really good aesthetic outcome is where the challenge is. Okay, so they're applying this to the surface and they're rubbing it as well. Um, right, and then they evaporate the solvent. So it looks like they're using a highly fibrous composite, according to them, and they're gradually applying it. Mind you, these are light curable materials, meaning at some point they need to light cure them after application. So I guess the rationale behind this is as you could see, the tooth is stained in certain regions. So they wanted to use this because it has strong color that may help mask those stains. And of course, that is not the final color that we want. The final color we want is more close to this. Okay, so that we get it a color that is matching with the natural teeth. That being said, very important step was done here. So they're building the inside wall, just the palatal wall, and they're saying this is the easiest way for this operator to do it. And then that light changed because I guess they're doing light cure. has to be strong. They fill all the gaps. They show you on the mirror. Sometimes this is what we're saying, so you could tell it's not really the easiest thing to do, especially looking through a mirror. But over time, you'll get used to it. Okay, so they're doing a composite layering technique for the filling, and they're saying that certain layers may not necessarily have the most aesthetic appearance because the operator here is using them for strength purposes. Okay, to reduce the risk of a fracture. Again, they're building the palatal wall. Actually, this is an interesting way. They're using some sort of metal thing. I didn't do this, so. Of course, there are other ways to do this. If you can get a good aesthetic, clean result while maintaining infection control and all of these things, then I guess up to you what to do, as long as you follow, of course, the norms and everything. Okay, so they're building the walls that is in between each teeth, proximal walls, we call them. That matrix looks like a metal matrix, and as you can see, that floss to help retract all of that rubber dam and these things. They're continuing with composite layering technique, and they're being very careful. If you notice something, so it looks like they're using some different shades of composite along with the build-up. Some shades are lighter, some shades are darker. I mean, for each, it has its own purpose. In this case, I guess, at least up to what they described. So the margin here, preparation margin, is very, very important to seal it really well because that is a place where recurrent decay tend to happen, actually recurrent caries. Okay, so the tooth, especially a tooth like this, is divided into like an incisal third, middle third, and cervical third. So they're working on the incisal third. The reason they're doing these things, they're trying to recreate the natural anatomy and the natural aesthetic for these teeth. A challenge here is that these two teeth are in the middle and front, especially in the upper, so that they are very visible. And trust me, people notice this as soon as you talk or smile. Um, so what does that mean? It means that they need to have them very symmetrical to each other. Normally, if you have only one natural tooth and you're doing the filling for the adjacent, then you can copy. But here, the operator is recreating both. He's doing the filling for both. Trying to keep the surface as smooth as feasible. So if you notice something, the like when they get to the final layers, they start to putting them as like one blob so that it's smooth and there's not really much lines in between them, and you can see in a bit how the surface is smooth and so forth. So some people have some additional like extra composite that they so that when they do the finishing and polishing, like things can you have extra composite that you have room to remove from that extra composite. Some people just put as much as necessary, to each their own. Everyone has different technique. So one sensitive thing when doing the anterior teeth, especially the upper central incisors, is that the height of the tooth also, they need to be symmetrical. That's why they're adjusting them. Also, this angle right here should be sharp, and the distal angle, it's called, should be a bit rounded. Also, it's very important note. So the distal should be rounded, the mesial should be sharp. Of course, in practice, can be slightly challenging to recreate this. With regard to finishing, some operators may use a pencil and do marks on the tooth in order to recreate certain grooves or certain anatomies that are present. They're using a polishing disc. So, but I like this. They're using rubber dam. They're doing layering techniques. They did it step by step. I was not too sure about the interesting way they did for the palatal, but if it works for them, and as I said, all things are taken into consideration. So they're doing adjustments in between them to make sure that the patient can floss in the future, because we don't want a beautiful composite, but problems in flossing. Freedom this time. Okay, so honestly, it looks really amazing. As I said, there are the two upper two central incisors. A good result. A lot of people may say, not a lot of people, but some individuals may say, oh, but like the gums are directly can be bleeding after the procedure. Yeah, because they just had rubber dam, the floss, retracting the gums, and so forth. So over time, even during that day later, if everything is done properly, of course, that bleeding should minimize and slowly stop. So they're checking their bite. This is before, and this is the after tooth preparation. Very good prep. Uh, Finish line. They cleaned all the caries. You can see they also used caries, a dye detector, and for this they did a nice prep. I would argue may need a bit smoothing, or maybe because the camera shows too much detail. Like for example, if you compare this prep, also this one needs, but this one needs a bit more smoothing. Then they did the layering technique. As I said, they built the palatal or the inside wall, and this is the final result. Honestly, looks pretty amazing. Thank you everyone for watching. If you liked the video, make sure to like the video. Don't forget to subscribe, turn the notification bell on. More than 90% of people or something like this watch, but they're not subscribed. So it helps the channel at pretty much zero cost to you. Thank you everyone.